Hi, everyone. Welcome back to Mad Barn Academy. And if this is your first time tuning in, then welcome. We hope to earn your subscription today. Today's topic for our presentation is going to be on equine proliferative enteropathy, or infection with Lawsonia intracellularis. This is a really important disease of weanling horses, and since late summer and fall are common times of year for a lot of people to be weaning their foals, I thought it would be a great time to discuss EPE. So let's get started. EPE, or equine proliferative enteropathy, is caused by a bacterial infection. The causative agent is called Lawsonia intracellularis, and Lawsonia is an obligate intracellular bacterium, hence its name, meaning it can only survive and replicate inside of a host cell. The cells that it invades are the enterocytes, or cells that line the small intestine. Infection with Lawsonia intracellularis results in thickening of the intestinal lining, which then results in poor absorption of nutrients out of the gut. It is a disease of young horses, pretty much exclusively, and most frequently seen in foals aged anywhere from 4 to 7 months. Generally, isolated cases on a farm are seen, so maybe one foal in a herd is affected, but some farms may experience outbreaks of Lawsonia if there are a large number of susceptible foals. We understand that Lawsonia intracellularis is transmitted through the fecal-oral route, meaning the foal consumes feeds or forages contaminated with feces containing this bacterium. What we're not 100% sure about is who's doing the contaminating. We think that older horses or potentially some other foals in a herd may act as asymptomatic carriers of the bacterium, so they'll shed it in their manure. It's also possible that contact with other domestic or wild animals that are carriers of the bacterium can contaminate the environment. So Lawsonia is a well-documented issue in piglets, so it's possible that adult pigs can act as carriers. It's also suspected that rodents or other wildlife may serve as reservoirs for the bacterium, but this is still kind of an active area of research. We're not 100% sure. In any case, feces carrying the bacterium contaminates feeds or forages. A susceptible foal is then going to ingest that bacterium. And for 5 to 17 days, that foal will be contagious, shedding bacteria in its manure, but not showing any clinical signs. This will contaminate the environment even more, putting other susceptible foals at risk. As I've already mentioned, Lawsonia intracellularis targets the cells that line the small intestine, and it particularly likes to settle in the ileum, which is that very last section of small intestine that connects to the cecum. Because this bacterium survives inside of cells, it's actually very good at evading the immune system, which is why foals can have a really hard time clearing this infection on their own. Now, once an enterocyte has been infected with this bacterium, that cell begins to replicate prematurely and excessively, causing this proliferative thickening of the intestinal lining. These cells cannot absorb nutrients from the small intestine normally, resulting in a malabsorptive disorder. Furthermore, inflammation in the small intestine from this infection causes protein from the bloodstream to actually leak into the gut, and this results in a condition called a protein-losing enteropathy. The image on the right side of the screen here is a transabdominal ultrasound image of a filly with a confirmed Lawsonia intracellularis infection. The loops you see are small intestinal loops, and these loops have really severely thickened walls. The white bar on the image measures 9 millimeters. Normal small intestine will have a wall thickness that is less than or equal to 3 millimeters. The risk factors for Lawsonia intracellularis infection are not well defined, but stress is thought to be a major factor. Stress compromises the immune system, making the body more susceptible to disease. We know that most foals are aged 4 to 7 months when they contract Lawsonia. What's also happening around this time? Weaning, which is a huge stressor for these young horses. Another thing that's happening around this same time is a phenomenon called immunity gap. Foals receive passive immunity from their dams through the ingestion of colostrum. So they receive these protective antibodies that serve as a surrogate immune system while their own immune system is very naive and still developing. However, those maternal antibodies begin to wane about 12 weeks of age. That foal's own immune system is still maturing, but it's not quite up to speed yet. So there ends up being this window of poor immunity where that foal is going to be particularly susceptible to disease. This is why your veterinarian recommends starting most foal vaccines around this time so that we can kind of bridge the gap for some of those really serious diseases or infections that could be life-threatening. So we sort of have this double whammy happening. We have a dip in immune protection, and we have this major life stressor happening, weaning, that compound each other, making these foals really susceptible to infections like Lawsonia intracellularis. Other potential risk factors include overcrowding or mixing of different species, which could contaminate the environment with even more Lawsonia if any of those animals are carriers. Dietary changes and transportation, which are other common management changes and stressors that are happening around the same time as weaning. And then use of antibiotics for any reason, which could alter the gut microbiome and make horses more susceptible to contracting Lawsonia. It's estimated that only about 10% of foals that are exposed to the Lawsonian bacterium will actually become sick. And it's thought that even fewer will develop clinical disease. Around half of these foals will develop what's called subclinical disease, which really manifests as kind of suboptimal weight gain or suboptimal growth. Now, the most common clinical signs of equine proliferative enteropathy certainly range in severity, but they can commonly include weight loss, signs of ill thrift or kind of failure to thrive, like poor hair coat or pot belly, loose manure or kind of a chronic diarrhea, signs of colic, poor appetite, fever, especially when they first contract disease, ventral edema, or kind of swelling along their chest, abdomen, and into the sheath or udder area, potentially dark or bloody manure, and then really rare or severe life-threatening infection is uncommon, but those signs would include evidence of sepsis. These foals will be really sick, they might collapse, or potentially even result in sudden death. A diagnosis of EPE is made using a combination of physical exam findings, like, this foal is the right age for this type of infection, and then some of those really common clinical signs that are going to point us in that direction. Supporting clinical pathological findings on blood work, such as really low protein and elevated white blood cell count. And certainly supporting ultrasound findings, like thickening of the small intestine, just like that image we saw a few slides ago. Now, the only way to definitively diagnose infection with Lawsonia intracellularis is through fecal PCR testing, which is actually going to detect the presence of bacteria in the feces. So your vet will collect a manure sample and then is going to send that off to a diagnostic lab with the capability of running that test. And certainly, false negatives can occur with this test. No test is perfect, but false negatives are more likely to occur, particularly early in the disease, before that foal is shedding a large number of bacteria. The treatment of EPE involves a course of antibiotics and then whatever supportive care might be warranted, really depending on the severity of disease in that given foal. Sometimes antibiotic therapy is extended for several weeks, or multiple antibiotics are used to eliminate the infection of Lawsonia. It's also important to remember that these foals will need kind of some special dietary support during this treatment and recovery period because they've been really malnourished for the duration of this infection. Using highly digestible fiber sources like beet pulp and forage pellets can make the digestive process easier for that foal and easier for their compromised gut. Adding extra fat and protein for calories and quality amino acids can support that loss of body condition. And then certainly ensuring that the diet is well balanced with optimal levels of highly available, bioavailable vitamins and minerals will help restore any vitamin and mineral deficiencies that have developed during this time. Prevention strategies are really centered around early identification of disease and then practicing good biosecurity if you believe a foal to be positive for Lawsonia or they've been confirmed so with a fecal PCR test. Additionally, pest and wildlife control measures may need to be a focus of your prevention strategy, especially if that's a particular issue for your farm. Lastly, there is the option for vaccination. The vaccine available is actually a swine vaccine, so use in foals would be considered off-label. But there has been some really promising results that it's an effective option for reducing the incidence of infection and reducing the disease severity for foals that may still become infected despite vaccination. So this would certainly be something to discuss with your veterinarian about implementing into your breeding farm or your program if you're concerned about EPE in your foals. Alrighty, you guys, here are references for today. And thanks so much for listening. Don't forget to like and subscribe. Be sure to explore the other videos on our channel. We have new videos coming out all the time on a variety of different topics. So there's always something for everybody. And be sure to check out the additional links I've provided in the description of this video below. There's some supplemental materials that I provided with some additional information on equine proliferative enteropathy, but also other infectious GI diseases in foals and colic in foals too, since there are a lot of other things that foals can pick up or other reasons why they'll act colicky or get loose manure. So it's important to differentiate between all those different ones and rely on your vet for help if anything comes up. All right, you guys, until next time.